Welcome back. Dr. Christopher Ninh is with us again today from South Coast Pediatric Institute. Nice to see you again.
Good morning,
It's
Ken.
always good to have you here.
Thank you very much.
And we're going to talk a little bit about both knee and hip replacement. And President Bush had a knee replacement not too long ago, the younger Bush, W. And do you know, did you ever read what was the cause that he needed one, or just simply a long-term injury that he had, or just simply his knee went out?
Well, President Bush is, ex-President Bush is very active.
Mm-hmm.
He had osteoarthritis, which is the main disease that people have total knee replacements.
Mm-hmm.
He took up a lot of bicycling because that's a more non-weight bearing or less weight bearing in terms of activity.
Mm-hmm.
And the great thing about the total knee and hip replacement is that technology has really changed in the last 5 years. I mean, not only the implants have changed, but the process and the surgical techniques have changed. It allows patients to get up and move earlier. Within 3 months, you're back to doing recreational activities, playing tennis, golf, bicycling. It's quite remarkable.
What do you find between the hip and the knee replacements? What is more prevalent in most people, the average person?
Well, I'm glad you asked that question. Right now, definitely the knee replacement is more prevalent. It's about 700,000 surgeries a year. It actually doubled from 2001 to 2011. Wow. And it's projected to 2030, it's going to have more than 3 million knee replacements. And the hip is about more than half of that. And so the indications are more now because the hips and knees replacements are lasting longer. We have now the 30-year knee, which lasts 30 years, okay, wow, because of the surface of the metal is different. The plastic in between, what's called polyethylene, is now cross-linked. That means that it's more durable. So again, you're getting these 30-year implants, knees and hips, and they haven't been in patients that long, but the WEAR study results in terms of simulation studies are showing that. And so the indications have expanded in terms of 60-year-old to 70. We're expanding it to now 50 to 80. We're having in patients 90-year-olds as well as 40-something-year-old patients having total knees and hips and doing very well and being very active.
Well, I can certainly understand with the knee because all the activities that we do, even golfing, is going to tweak the knee. We see this with top golfers all the time, with Tiger Woods and all of them. And I've even noticed you get out of your car in a parking space, you open the door, it's tight, and as you get out, you often will tweak one of your knees a little bit. That certainly has happened to me. So I can see why the knee would be a little bit more. Explain here with the model here, first of all, what happens to the knee when you get the most common type of an injury where you may have to look at getting a knee replacement?
Sure. So osteoarthritis means just basically a disease that's wearing down the joint. Your cartilage surface is worn down, okay? And that's both genetic and mechanical components. So some people are born with better cartilage than others, and then some people are heavier and they do more activity, so they wear out the joints like a tire. Always really refer to it like a tire. And when it's worn down, what we do is then we shave the cartilage and the bone off, and then we replace it with a implant metal. I always have an analogy to teeth. We kind of basically do a shaving, and then we put it over and we cement the metal implant onto the bone, okay, and then we put plastic insert in between, and it's directly size specific to certain patients. There's some implants are gender specific too, but it's size specific and it works out really well. Now I want to talk about the hip also, in which basically we do the same thing. So osteoarthritis and the joint is basically worn down through years, and basic cartilage is gone. Okay, the cushion cartilage is gone. So now you have bone-on-bone disease, and now we have a new approach. It's called the direct anterior. I mean, it's fairly new. It's been out there, but not a lot of people do them. It's a muscle splitting approach in the front. We do not cut any muscles, we split the muscle. Traditional surgeries, they do a posterior, and more prevalent surgeries, more than 80% would do a posterior approach, in which they cut muscles in the back to access the hip.
Right.
And the problem with that is when you have larger patients, when you cut those muscles, it's hard to rehabilitate.
Sure.
When we don't cut any muscles, we're able to rehabilitate faster, get up the same day. And the reason why we're able to do that is we have special technology in which we have special tables in which I use. It's called a HANA table, in which we're able to distract the joint using hydraulics, using special hooks to lift the hip up, and then do minimally invasive 4-inch incision, and we're able to cut and bone and access the hip through the front. And
get the implant in.
Get in the implant
Wow.
in, and the implants are I use, which are modified implants, are smaller, and they're able to access easier. And then the awesome thing is people are able to get up, and we do it under X-rays, and so the implant orientation is perfect. I mean, we do not leave the room unless the position of the cup, the position of the stem look perfect. And we're able to match the leg length. We're able to make sure the implants are in the correct position so they don't dislocate. So we're able to do this. Where before we did it without X-rays, we did it kind of back, it's rather kind of blind. We use special techniques to measure in the OR, but they're a lot of times not perfect. And with fluoroscopy, it's near to perfect because we're able to see what we're doing under X-ray.
Now, if someone has one of these problems, can it lead to the other? I mean, if you have a knee that's going bad, pardon me, can it affect your hip?
Well, absolutely, because what it is a lot of people have knee arthritis, and it's like wearing down the tires. Their tire's bad. They're genetically prone to arthritis in other joints of their knee also. So they have a predilection to getting arthritis. And then a lot of times they're more heavy set, so their joint's going to wear down. So they're going to wear out other parts of their joint, mostly the weight-bearing portion, the knees and the hips. And so a lot of people, and back also, if you have knee problems, you probably have hip problems. If you have hip problems, you probably have back problems, because all these are kind of more weight-bearing joints, and they're worn down with time.
When does a person kind of, what are the indications that maybe this is not just something that, you know, it's been with me for a month because I injured it playing something?
Right.
How do they know they need
Well, I'm very
expanded
conservative. Basically, it's a gradual process. Like a tire doesn't wear out right away. I mean, it takes time, okay? So people gradually wears out their joint. They have pain, then they have swelling, years. I mean, this process takes years, but at some point, they're bone on bone.
Right.
Everything's worn down. Okay, the rubber's gone. Okay, and their leg starts to deform because they wear out certain parts of their knee, and then they get deformities, and then there's bowed or basically, you know, these deformities, and they can't tolerate anymore. And they've done everything: injections, minimally invasive arthroscopic surgeries, therapy, bracing, and basically it's then the road. And the bone on bone is then the road, and then the knee replacement. We can correct alignment. We can straighten out their leg. We can put in these implants, which they can get up and moving, and virtually in 3 months, get back to playing tennis, playing golf, and doing the recreational activities that they love. I ask patients typically, what does it feel like after 6 months? They say it feels like normal knee. It doesn't feel like any metal. It doesn't feel like anything weird. It doesn't feel anything mechanical. It feels like normal knee, and now I have no pain when I do activities.
All right.
That's
Pardon
remarkable.
me. I got a little frog in my throat here. Doctor, I want to thank you very much, and I want to give you your number out as 714-423-9990, and also his website is drnin.com. Great information. I really appreciate it, and the technology is just absolutely wonderful.
Thank you, Ken.
All right, good to see you again. We'll be back in just a moment.